Ever just look at your newborn and think, why are they peeling like a croissant? And what is that smell coming from their belly button? You are not alone. I'm Dr. Mona, a pediatrician mom, and your guide through the wonderfully weird world of newborn care. Today we're talking flaky skin, baby acne, belly buttons, and everything in between. The stuff no one tells you until you're up at 3 a.m. Googling it in a panic. So grab your coffee again, a burp cloth, you'll need it, and hit the subscribe button if you want parenting tips that are practical, honest, and just a little funny. Let's do this. Let's start with the biggest freak out for most new parents. Why is my baby peeling like a buttery breakfast pastry? That flaky skin, totally normal. Newborns shed their outer layer in the first week or two, especially if they were overdue. You don't need to fix it, but if it's bugging you, a fragrance-free baby ointment or lotion is fine for the body. Just skip the face because their cheeks are sensitive and they can break out easily. Speaking of breakouts, baby acne, those tiny red bumps around 2 to 6 weeks, blame hormones. Not yours, well, okay, actually yes, yours. It's like your baby borrowed your postpartum glow and kept the pimples. Don't pop, scrub, or treat it. It clears on its own, usually by 2 months. And if you're looking for a video solely devoted to newborn rashes, I got you covered here. Goopy eyes, if your baby looks like they cried glitter glue, it's likely a blocked tear duct, super common in newborns. You might see a watery eye, crusting, or some yellow discharge, especially on one side. Here's what's going on. The little channel that drains tears from the eye to the nose isn't fully open yet. It usually resolves by 6 to 12 months, but you can help with something called the Krigler massage, basically a gentle unstick the straw move. How to do it? Wash your hands, place your clean finger where the inner corner of the eye meets the bridge of the nose. Apply light pressure and stroke downward along the nose, like guiding a tear towards the nostril. Do this about 5 to 10 strokes 2 to 4 times a day. This helps open the duct and encourages proper drainage. If the eye gets red, swollen, or starts oozing green gunk, call your pediatrician. Next is stuffy noses. Very common in all newborns, especially common in C-section babies. Think no birth canal squeeze to squeeze out that extra fluid left in the baby's nostrils. If your baby's eating and sleeping just fine, no need to do anything. But if congestion is messing up with feeds or sleep, go with this combo. Saline drops first. They can loosen the gunk. If they're still bothered, then you can gently suction out with a bulb suction, like this one, so cute, or nasal suction. Remember to not overuse this. It's only if needed for discomfort. Ears. Step away from the Q-tips. Earwax is nature's noise-canceling gunk. It protects, cleans, and keeps out dust. Just wipe the outer ear with a washcloth after baths. No digging, no DIY ear archaeology. Their ears aren't a home renovation project. A question I get a lot is, do I need to bathe my newborn every night? Short answer, no. Newborns are not sweaty gym bros. Sponge baths are all you need until the umbilical cord falls off, which is usually by 1 to 3 weeks. After that, 2 to 3 times a week is plenty for a bath. You can bathe them more frequently if it's part of your soothing routine or bedtime routine. Just monitor for dry skin and use baby-approved products that are more sensitive on their sensitive skin. Let's walk through what that first real bath looks like without the panic. First, fill a baby tub with just 2 to 3 inches of warm water. Use your wrist or elbow to test the temperature to make sure it's not too hot. Now here's a little magic trick most people don't tell you. Start by lowering your baby in the tub bottom first. This keeps their chest from getting hit with cold water all at once and helps prevent that startled scream. Support their head and neck with one hand and ease them in slowly. Once they're in, use a cup or washcloth to pour warm water over their chest and tummy. Keep it flowing. This helps regulate their temperature and keeps them calm. And if your baby hates bath time, try a swaddle bath, a total game changer, and here's how it works. Loosely wrap your baby in a thin swaddle or muslin blanket. Lower them into the warm water while still wrapped. Then gently unwrap and wash one limb at a time, rewrapping as you go. It mimics the womb and makes them feel more like a spa day than a surprise plunge into cold water. Use a mild, fragrance-free cleanser just once or twice a week. Focus on the areas that get the dirtiest: neck folds, underarms, hands, and of course the diaper zone. You don't need to lather them up like a car wash. Once you're done, gently lift baby out, wrap them with a warm towel, and pat dry. Don't forget to get into all those sneaky little creases where moisture hides. Then moisturize with a fragrance-free ointment. Lotions are fine, but ointments lock in that hydration way better. And just a reminder, skip the bubble baths for now. They can irritate that brand new skin and also in baby girls can lead to vaginal irritation. And for laundry, stick with hypoallergenic, fragrance-free detergent. We use All Free and Clear. This is not sponsored, but there's no need to drop money on fancy baby-only versions. It's already gentle to use these hypoallergenic ones that we may use for our family. And if this has been helpful so far and you're thinking, why didn't anyone tell me this at my baby shower? Go ahead and subscribe. I've got so much more coming to help you feel less overwhelmed and more confident as a parent. Let's talk about one of the weirdest newborn things that really freak parents out, the umbilical cord stump. It's not a loose thread on a sweater, so please do not pull it. Don't soak it, and please don't mess with it. It's healing tissue, and it needs time to do its thing. So what is it? That little shriveled black nub is what's left of your baby's literal lifeline, the umbilical cord that connected them to your placenta. Now it's drying out and preparing to fall off. That usually happens within 1 to 3 weeks, but sometimes it takes longer. For some babies, like my own, it can take up to 2 months, and that's still okay. But by 8 weeks, if it hasn't fallen off, check in with your pediatrician. Now, what should you do while it's still on? Keep it dry. If it gets wet, just gently pat it dry with a clean towel. Fold the diaper down to keep it from rubbing. Think of it like giving the stump its own private healing suite. No pressure, no friction. When it does fall off, you might see a little blood, some crust, or even yellow goo. Totally normal. That's your baby's body doing some post-party cleanup. But here's where it gets confusing. The smell. Some odor is normal. Remember, it's drying dead tissue. Think healing scab, not a bed of roses. But if it starts to smell foul, or if you see redness spreading to the skin, pus, or your baby seems uncomfortable when you touch it, call your pediatrician. Those could be signs of infection, and we want to catch that early. Now let's talk about what might pop up after the stump falls off, or even as it starts loosening. If you notice a squishy, pinkish, gooey lump that oozes like jelly on toast, that's probably an umbilical granuloma. It's not dangerous, it's just your baby's body getting a little too excited about healing, sending extra tissue to the site even after the stump said, I'm out. If it stays gooey, your pediatrician can treat it easily in the office with something called silver nitrate. It looks like a skinny matchstick, but it's not hot, it doesn't hurt. We just dab it on, and with time, that chalky substance of the silver nitrate, poof, the goo is gone. Like a magic belly button reset. Bottom line, goo, usually fine. Goo that doesn't stop, still fine, just let us take a look. Don't panic, just add it to your growing list of things nobody told me about, but thankfully, Dr. Mona did. Newborn nails grow like they're training for a Wolverine audition, fast, sharp, and always ready to make an appearance on their own face. You'll want to file or clip them whenever they look long, not just once a week. It helps minimize those dramatic looking face scratches, which by the way, aren't harmful, but let's be honest, seeing your baby with claw marks across their cheeks is not the vibe. Pro tip, cut or file their nails after a bath. That's when their nails are softest. Less cracking, less flinching, less trauma all around. And if you have multiple caregivers in the house, hand the job to whoever has the best hand-eye coordination. At my house, it's my husband. I blame my astigmatism. Tiny nails and blurry vision do not mix. To this day, I have not cut either of my children's nails because that is a job for dad. If you're nervous about clipping, stick with a baby nail file or use a gentle electric baby nail trimmer. It's slow but safe and great for anxiety. And yes, if you accidentally clip their skin, welcome to the club. It can look dramatic, cue more blood than seems possible for that tiny body. My husband once clipped our son's finger and our nanny at the time almost fainted. But it usually heals just fine on its own. Just clean it gently, monitor it, and call your pediatrician if you're ever unsure. Now let's talk about those skin folds. Under the neck, behind the ear, under the underarms. You might find white waxy residue. That's usually just vernix or skin gunk from being in utero. Totally normal. Just gently clean it during bath time, no scrubbing, no stress. But here's when to call your pediatrician. If a skin fold looks red, raw, smells yeasty or sour, or if you see little bumps or irritation, it might be a rash or early yeast infection. These areas stay warm and moist, which makes them prime real estate for irritation if not cleaned and pat dried well. So when in doubt, wipe, pat dry, and check those creases often because they can hide a lot of gunk, like a lot. We're almost done here, but if you found even one helpful tip in this video, hit that like button, hit that subscribe button. It's the easiest way to stay in the loop for more no fluff, real world parenting advice. Now let's talk about diaper area care because yes, it varies a little depending on the parts your baby came with. For girls, wipe front to back, always. That helps prevent urinary tract infections, which happen if particles from the anus, where poop comes out, travels to the vagina. Yes, that's why wiping front to back is recommended. Gently spread the labia to clean away any poop, but no need to scrub like you're polishing silver. Just a gentle wipe will do. For circumcised boys, you'll want to use Vaseline for the first week or so while the area is healing, while you see that healing tissue. A little dab on a 2x2-inch gauze with each diaper change helps protect it and keeps the diaper from sticking to the healing skin, which would not feel so great when you remove that diaper. For uncircumcised boys, don't force the foreskin back. Just clean the outside like any other body part. As they get older, the foreskin will gradually start to retract on its own. And when it does, you only clean what's easy to access. Never force anything down. There you have it. Comment below with your biggest newborn care surprise or a nobody told me that moment. I probably have more tricks and tips up my sleeve that I can't remember. So if you have a Dr. Mona, what the heck is going on with my newborn, toddler, preschooler, or child? Comment below because I likely have an answer. Be sure to subscribe to my channel for more real-life parenting tips from a pediatrician mom who's also been in the newborn trenches twice with my own kids and hundreds of times with my patients and their families. Want my full newborn checklist and free guides? Tap the link in the description. And if you found this helpful, give it a like, share it with a new parent friend, and let's keep the chaos manageable together. You've got this, and I've got your back. See you all in the next one. Stay well.